Thank you, Dr. Dines. We have no wimpy topics this morning, and my vocabulary is expanding at an alarming rate. Our final presentation of the day is Cracking the Case, the Flint Water Crisis and Public Health Advocacy, which will be presented by Dr. Mona Hanna-Attisha, Director of the Pediatrics Residency at the Hurley Medical Center and an assistant professor at Michigan State University, where she leads Hurley Children's Hospital Public Health Initiative, an innovative program that provides the public health tools to advocate for Flint's children's healthy development. In 2016, Time magazine named Mona one of the 100 most influential people in the world. Please welcome Dr. Mona Hanna-Attisha.
How's it going? So I'm going to share some water porn with you today. So it's a little different than the last speaker. And I am waiting for my clicker. All right. Thank you. All right, it is great to be here, and they even gave me a stool because I'm a little over 5 feet. I have nothing to disclose. And here's my picture of water porn. So look at this image, and it's absolutely hard to believe that this could be true. Was this photoshopped? Is this real? Did they put like iced tea in here? Could this be coming out of the tap in 2016 in America? It's hard to believe that this could be true. And unless you've lived underwater, you've hopefully heard about the Flint water crisis and hopefully seen images like this. And what's even harder to believe is that this happened in Michigan. Where's all my Michigan folks out there? Awesome, woohoo! So those of us from Michigan, how do we share where we are from the state? We use our hand, awesome. So point to where you are from Michigan. So we are the Mitten State, and we are the Mitten State because we are surrounded by the Great Lakes. We are surrounded by the largest source of fresh water in the world. 20% of the fresh water is in Michigan. And Flint, Michigan is literally in the middle of the largest source of fresh water in the world. And to this day, in our third year, we have a clearly demarcated population of children who are poor and predominantly minority that yet to have access to safe drinking water. It's hard to believe. And what's even harder to believe is that it happened in a city that really helped build America. So Flint, Michigan was the birthplace of General Motors. We put America on wheels. Flint did not always mean disaster. So we were the birthplace of manufacturing, the birthplace of the historic sit-down strikes that created the unions, that created the middle class in America. So these are kids protesting in solidarity with their parents for better food and a better life and living wages and occupational health and safety. And those kids, they won. They created the middle class. And at one point, Flint, Michigan had the highest per capita income in the nation. We had some of the best public health indices in the nation. And people from all over the world, moved to Flint for great living wage jobs, for great infrastructure, and for great schools. But not anymore. We lost those jobs, and now we lead the nation in all the bad stats, in unemployment, in violence, in disparities, dismal health rankings, every adversity and toxic stress that threatens the life course trajectory of our children. And they're all symptoms of deep, deep poverty. Our kids in Flint have an over 60% poverty rate. A child born in Flint has a 15-year less life expectancy than a kid in a neighborhood suburb. And because of all this, Flint was almost bankrupt. In 2011, we were at this near bankruptcy state, and in Michigan, when you're almost bankrupt, the state can take over democracy. So we were under the control of state-appointed emergency managers, where the goal was save money, save money, save money, save money at no costs. And in an effort to save money, they severed a half-a-century relationship that we had with Detroit, where we were getting fresh, pre-treated Great Lakes water for a half a century, and they decided that was too expensive. It was too expensive to get fresh, pre-treated water, and they started drawing water from the local Flint River. In April of 2014, with a very simple flip of a switch, we started drawing water from the local Flint River. And it didn't seem right. And the heroic people of Flint raised their voices. And they raised their voices, and they continued to raise their voices. But in a city that had lost democracy, where did those voices go? They went nowhere. And the people of Flint were literally told to relax. And this was even when General Motors, which is still in Flint, stopped using this water because it was corroding engine parts. Think about that. The people of Flint were told to relax and drink up. Get this water, our drinking water, was corroding engine parts. And it turned out that the Flint River water was 19 times more corrosive than the Detroit water. It was missing an important ingredient called corrosion control, which is part of all treatment. It's like a medicine that you put in the pipes to prevent the lead that's in the plumbing from coming out of the plumbing. And there's lead in all of our plumbing. We were stubbornly slow as a nation to restrict lead from our plumbing. It wasn't until 2014 that we restricted lead from our brass faucets. So that lead came out of our plumbing and into our drinking water. And when I first heard of the possibility that there was lead in our water, I put my researcher hat on. So I took my clinician hat off and I put my researcher hat on, because I knew if I wanted to move mountains, I needed to have data in my pocket. And what we did was we looked at children's lead levels that were routinely done through Medicaid mandated screening before and after the water switched. And it was the easiest research project I have ever done in my life. And we looked at the percentage of kids with elevated levels before the water switch, and we compared them to levels after the water switch. And contrary to really every trend that was happening in our nation, in our state, and in our city, where it's really been a public health success story. We have gotten lead out of paint and lead out of gasoline, and every year that percentage of kids with elevated lead levels has been coming down and down and down. But this was contrary to any of that trend. So what we saw was that the percentage of kids with elevated lead levels doubled in the city after the water switch. And in the areas where the water lead levels were the worst, we saw the greatest increase in children's elevated lead levels. For example, in the middle of the city, in that red area, is an area called Ward 5. And in that ward, we saw the highest water lead levels. 32% of the water samples taken in that ward exceeded the EPA's action level of 15 parts per billion. And in that ward, the percentage of children who were tested with elevated lead levels went from about 5% to almost 16% of kids who were tested had elevated lead levels in that ward. So then we wanted to see why did this have these hot spots? And then I kind of became a water expert, and we compared it to the water age map of the city. So this tells you how long it takes water from the treatment plant to get to different parts of the city. So the treatment plant happens to be in the northeast corner of the town, and water travels from that treatment plant around the periphery of the city, and then it gets to the city center last. And that red area in that map, it takes about 7 days for the water from the treatment plant to get to that city center. So that has more time to sit in contact with lead plumbing, so that corrosive water in contact with the lead plumbing. And that directly correlated with where the water lead level was the highest and where the kids' lead levels were the highest. So when we realized that we found this in our research. We couldn't wait to publish this in peer-reviewed journals, because that takes, as you know, forever. It could take months and months. And we had to share this information with our community as soon as possible. So we held a press conference. And that's usually not what we do as pediatricians, but this is where I had to put my advocacy hat on. Because as physicians, we have taken an oath. We've taken an oath to be healers, to be protectors, and as pediatricians, it's in our job description to be advocates and to use our voice when our children have lost their voice. And in children, the voices of our children had been squashed. So we shared at this press conference what was happening with our kids in a podium just like this, but I was a lot shorter. And shortly thereafter, the state dismissed this research. They said I was an unfortunate researcher, that I was causing near hysteria. But this was a fight that we couldn't lose. We were fighting for our kids. We were fighting for their tomorrows. So finally, the sheer weight of the data, the facts, the evidence made that tide turn, and we were able to protect our kids. And it is now published, so if you want any bedtime reading, you could check it out. And from the moment that we realized that we had this widespread lead contamination, I put my clinician hat back on. This is Lily. This is one of our Flint kids, and she just came in for a 4-year checkup. She's adorable. She's beautiful. She's smart. I asked her what she wants to be when she grew up. She said she wants to be a president, a ballerina, and a basketball player. And I said, yes, you can do all of that. So look for her in 30 years for the next presidential election. So our focus shifted to our kids, and how are we going to preserve the tomorrows of our kids? And this is where we are now in Flint building a model public health program because we know what lead does. And I don't have a magic pill. I can't take it away. It's an irreversible, potent neurotoxin. And we know it affects our Flint kids just like it affects our Detroit kids and our Chicago kids and our Baltimore kids and our DC kids. It's a form of environmental and the social injustice. And in Flint, that injustice only widened. But we owe it to our kids who did nothing wrong besides live in a poor city that was almost bankrupt, that didn't treat its water properly. We owe it to them to do everything we can to mitigate the impact of this exposure and to preserve their tomorrows. And today in Flint, I find myself working in a city that is redefining itself, that is turning around, that is rebuilding a future where we're not going to be defined by this crisis, but really where we're going to be defined by what we do after this crisis. I have the great privilege to lead this pediatric public health initiative, a partnership between Michigan State University and Hurley Children's Hospital, 2 institutions that have been in Flint for over 100 years, to really flip the story for our children, to be innovative, to do something that hasn't been done before, to build resilience in our kids. We've heard a lot about resilience over these last few days, and we are focusing on building resilience because the treatment for lead is the same treatment that builds healthy children and strong communities. It is investing in our young, especially our youngest, and our most vulnerable. It is wrapping them around with every evidence-based intervention, such as maternal infant support programs, early literacy, and school health services, and nutrition access, and access to health care, and hope. It is actively building hope in our children and hope in our families. And I tell kids and I tell my patients when I see them, it's almost as if I'm writing prescriptions for hope every day, so that these kids know that they have an even brighter tomorrow, really, than their yesterday ever was. So where are we now in Flint? We still, to this day, do not have water that we can drink. That corrosive water that wasn't treated severely ate up our pipes. So you can think of it like our kids are drinking through lead-painted straws, and you never know when a piece of that corroded pipe is going to come off and into our drinking water. But today, we have a lot to celebrate. We have Medicaid expansion, which has added 15,000 more kids and pregnant moms onto health insurance. We've doubled the capacity of our maternal infant support programs. We have expansion of breastfeeding. We have universal early intervention. We have a huge campaign on early literacy. We have Reach Out and Read on steroids right now. We have quality child care centers. We have a universal preschool for our 4-year-olds. We used to have 1 school nurse. We have 9 school nurses now. We have 3 new school-based health centers. We're reinventing community schools. We had mindfulness programming for every kid in all our schools. We've expanded our food assistance supports. We give out nutrition prescriptions to every kid that comes to our clinic. We have mobile markets that go out into the community to deliver food to kids who don't have access to food. And people ask me, what's the best thing that our kids need? What's the most important thing we can do for our families? And it's economic development, it's jobs, it's living wages, it's lifting our families out of poverty, and we're working on that too. And a lot of this is happening in my clinic. So this is my clinic. So our clinic is actually on the second floor of a farmer's market. It's the only clinic that we know of that's co-located on the farmer's market on purpose because we have no grocery stores in Flint. And this clinic is also directly across the street from the central bus stop because in a city that built cars, we have terrible transportation barriers. And this clinic has a social worker, and we have a WIC office, and we have integrated behavioral health, and we do those nutrition prescriptions, and we have Reach Out and Read, and we're bringing the VIP program. But this is where another hat of ours comes on as pediatricians. As a residency director, this is where we train the next generation of pediatricians. This is where our medical students and our residents come to learn, because it's important for me to go out there and be an advocate, but it's more important for us, for all of us, to train the next generation of physician advocates. So what have we learned beyond Flint? We've learned a lot. We've learned that lead is still a problem. So we used to think lead was a problem of yesterday. We took care of lead, but lead's hard to get rid of. It's a gift that keeps on giving. So it is a problem of yesterday, it's a problem of today, and it's a problem of tomorrow. But because of Flint, we've got lots of silver linings happening. So now at the state level and the federal level, we're looking at lead, and we're looking at lead elimination. We're looking at primary prevention. We no longer should be using our children as canaries for environmental issues. We need to be getting at the problem, because the only treatment is prevention. We're also learning about lead in water. I'm a pediatrician with a public health, environmental health background, and I didn't even know that there was the possibility of lead in water. We're very much obsessed with lead paint and lead dust, which are all very important to do as well. But we need to know that there's possibility of lead in our water, and it should have been something we always knew, because the word plumbing comes from Pb, which is the elemental symbol for lead. The Romans used plumbing to build their aqueducts, so it was always made out of lead, so it should have been something we knew about. The federal lead and copper rule, which is part of the safe drinking water, is going through revisions to strengthen these regulations. So we need to all be advocating to have more protections. There's nothing in there that protects children in daycare facilities and schools. It is a weak rule. We're also talking about public health, and how public health is underfunded and undervalued and very reactive and not proactive. We need health in all of our policies, but we need kids in all of our policies. We need the voice of children in all of our policies to make sure that they are protected. We are also increasingly talking about environmental injustices. What happened in Flint is an environmental injustice, and there's environmental injustices throughout our country. It's our poor and our brown kids that are disproportionately affected by these tragedies. And we are continuing to talk about ACEs and toxic stress, because lead is just one toxic stress that our most vulnerable children face. And lessons that I have learned that I hope that you can take away with is that we as pediatricians have incredibly credible and powerful voices in our communities. And people listen to us because we are the experts on kids. My voice eventually became a megaphone for our kids. And you have that megaphone, you have that microphone. Use your very credible voice in your community. Communities are yearning to hear from you. Please use your voice and get out, leave your offices, leave your hospitals, and get out into your communities, because our kids need you. And we wear many hats. We have lots of hats, and sometimes we wear one more than the other, and sometimes we wear all. We are very much clinicians, and that's our recharge when we hang out with those patients, and that is a beautiful relationship. But we are researchers, and we have to remain curious and ask those important questions, and we have to be advocates, because we have those very credible and loud voices, and we have to be committed to being educators so that we can train those next generation of clinicians, advocates, researchers, educators. And realize that when you are in these fights, you are never alone. Every day, I'm so grateful to be part of a professional society, the American Academy of Pediatrics, that first and foremost cares for our kids. So our state chapter, our national chapter, there's a bazillion parts of the AAP that I've learned about that I never knew existed, from government affairs to environmental health to media to all these different incredible arms. So we have an incredible professional organization that has our back no matter what our fights are. And I've also learned to make friends outside of our discipline. So as a pediatrician, we very much live in our bubbles of other pediatricians, but there's other folks just like us who care about kids just as we do. It's teachers and early educators and social workers. So make friends, build a network, and your fights will only be stronger and more powerful. I've also learned that you have to be prepared to crack the next case. So you never know. You don't wake up in the morning and say, oh, today I'm going to save the world. No, you need to be prepared. And coming to things like this and going to different workshops will help you be prepared. So bone up on public health and environmental health and community peds and advocacy work. Go to legislative trainings, meet with legislators. They're just regular people, just like you and I, and it's amazing how much they want to learn from you. And don't be shy of the camera. Go to media training. If someone asks you, hey, can you speak about HPV? Like, okay, I'll try. And the next time you'll do it, you'll do even better. So this needs to be part of all of our toolboxes. And vote kids. If there ever was a story where the importance of having legislators who care for kids, it's this Flint story, but it's also the story we're right now with our national election. And if there was ever a time where I wish our kids could vote, it would be now. But we can vote for them. So vote for kids. And then it's always the kids. Everything we do is for our children, and having that as in the back of your head and really in the front of the head all the time in the work that we do helps ground us. And I want to share a story of how our kids are leading the way. So this is a water bottle chandelier. So in Flint, we have tons and tons of water bottles. And teachers from an early childhood classroom said, hey, our toddlers made something for you. I'm like, okay, what is it? They said, it's a water bottle chandelier. I'm like, all right, bring it over to clinic. And it's this gorgeous multicolored chandelier that's taller than me, and it's hanging in our clinic right now. And these 2-year-olds turned something that is so tragic into something that is so beautiful. And it serves as a very daily reminder of our work of turning tragedy into beauty. And it hangs in the clinic right now, and everybody who sees it smiles, and it's hard not to smile of the work that we are doing, all of us, that we can do to turn to beauty wherever we are from tragedy. And I'm going to use a line that I know Dr. Dreyer loves as well. It's easier to build strong children than to repair broken men. And we're using this over 150-year-old line from this playbook in our work in Flint. And in a city that used to build really, really strong cars, we are now committed to building really, really strong children. Thank you. 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 You're awesome. Thank you.
So, I have many wonderful privileges as president. One is to give hugs to Mona.
I love hugs.
I've been on the stage with her multiple times, and she always knocks it out of the bowl. I usually think, boy, I wish I could have been like that at her age. I'm here to present Mona with an award. And this is the President's Certificate for Outstanding Service. This is what I call the Academy Awards of AAP Awards. It's really meant for the heroes out there. And of course, I can't think of anyone who's more of a hero than Mona is for children. And by the way, last month I was privileged to spend time with Mona at her site and see the water bottle sculpture and see the wonderful public health initiative that she has developed there. It's really amazing. So I'll just read it to you and then give it to Mona. The American Academy of Pediatrics, in recognition of outstanding service and personal dedication to the mission and goals of the Academy and to the health, safety, and well-being of children, presents this President's Certificate for Outstanding Service to Mona Hanna-Attisha, MD, MPH, FAAP, with love.
Thank you. Thank you.
Thank you.
I think we're supposed to, I'm supposed to get on this side.
Thank you. Thank you. Thank you. Thank you. Thank you.
Okay.
Thank you. Thank you so much.